Hello, I'm Alden. I'm a third year medical student at OUH-COM, and I will be demonstrating a newborn exam on our willing patient here. The cat was not willing to participate, but we are going to use his cat tree as our exam table. So let's get started. To begin, we'd start, with the newborn on their back. Just kind of look. Are they awake? Are they asleep? Are they warm, cold? Blue, cyanotic, or red, well perfused, kind of just getting those general signs first. Then we check their vitals if they were available, or we take them looking for a heart rate somewhere between 120 160, respiratory rate between 30 and 60, things like that. And we check their breathing, see if they're having any difficulty breathing, looking for grunting, retractions, anything like that that might indicate distress. Then we'd, from top to bottom, start at the head, just give it a general inspection. We can sometimes see molding after birth, which can be a normal finding, just deformity, from the birthing process that will resolve within a few days, just because the sutures aren't solid and the head can kind of compress as it goes to the birth canal. More pathologic findings we could see would be something like a cephalohematoma due to bleeding under the periosteum, so it would not cross suture lines. It's more common if there was a vacuum or forceps assist with the delivery, and this can increase the risk of jaundice as the hemoglobin that's in the bleed breaks down. And another abnormal finding would be caput succedaneum, and this is swelling that crosses the suture lines. And this can just be due to the forces of delivery. It should resolve on its own after a few days. And a more serious condition would be a subgleal hemorrhage, which is bleeding from the emissary veins, which again is above the periosteum, so it would cross suture lines, but this can lead to significant blood loss, so may see symptoms of that. Another abnormal finding would be cutis aplasia, where the skin doesn't fully cover the scalp, so may see some breaks in the skin. This isn't an emergency or anything, just could prompt further evaluation and should resolve on its own. Then we move on to the face, just giving the face a general inspection, looking at the ears. Do want to see that the upper ear is in line with the outer corner of the eye. Any abnormal placement too low, or not fully formed, maybe not having a fully formed helix, not having the crus, the fold in the ear, or having any skin tags or pits, could indicate a genetic condition, some sort of hearing loss, kidney anomaly, something like that. So it should prompt further evaluation if we notice any abnormal findings with the ears. Then we would move to the eyes. Let me grab the ophthalmoscope. And kind of looking at the set of the eyes. Are they wide set? Are they narrow set? Do the palpebral fissures slant upwards, downwards? All of these, within subtle variations of that, could be normal based on the look of the parents, genetics, things like that. But any serious deviation, really wide set or a big slant, could prompt further evaluation. And we'd be looking next, turn on the ophthalmoscope, looking in the eyes for the red reflex. Should be a flash of red light, symmetric in both eyes, which comes from the normal distribution of the retinal blood vessels. So if we don't see that, or it's asymmetric, could be indicative of a congenital anomaly in the retina or a retinoblastoma. So those babies should be referred to ophthalmology for further evaluation. And a coloboma could be found, which is just missing eye tissue, especially in the iris. You can kind of see the pupil filling out a missing chunk of the iris, and that's a concerning finding that should be sent to ophthalmology. Next, we'd look at the nose, looking for the patency of the nares. This is especially important if since neonates are preferential nasal breathers. If you're hearing loud breathing when they're crying or when they're feeding, we really want to check to make sure those nares are open. You can insert a French catheter in through the nares to check the patency. And they can be a little tight just naturally due to edema from suctioning at birth. So that can be a normal cause of abnormally closed nares. Or it could be an abnormal cause like choanal stenosis or atresia, which in that case we would want to refer to ENT. Could be indicative of something like Charge syndrome. Next, we would be looking at the mouth and the jaw. And first, just seeing that they have a natural suck reflex. That's important for breastfeeding, things like that. And then we do want to, check the hard and the soft palate. The finger checking for any cleft palate. You would see a cleft lip, and those would go to ENT to be fixed. Sorry, I have to keep the computer screen on. And another thing that we would want to look for is a tongue tie or ankylosglossia. We do want to see the tongue coming out past the lower jaw. If it's tied down, they could have trouble breastfeeding. So the treatment for that, if it is present and causing issues, would be a frenotomy. And that's all we're looking for with the mouth. And we would move on to the neck. One thing we look for is neck webbing, which can be indicative of Turner syndrome. Redundant skin, might think Noonan syndrome. And want to check the clavicles, make sure they're smooth, especially with a birth involving shoulder dystocia. The clavicles can fracture, so want to check for that and make sure it's taken care of. Then we look at the chest, see if it's normal. We could see pectus excavatum, which would be, a sunken sternum, or carinatum, which would be a raised sternum. And those are more common in either connective tissue or cardiac diseases. So definitely want to evaluate something like Marfan. So want to evaluate those further if we see any abnormalities with the chest. And then we would move on to the heart. Of course, I don't have my stethoscope with me, but we would, also take the heart, check the heart rate if we didn't already check the vitals, again looking for 120 to 160, somewhere in that range. A common murmur, benign murmur, could be a continuous machine-like murmur, which would be indicative